Cancer is a disease that, when mentioned, everyone feels fear and anxiety. It is one of the leading causes of death worldwide, leaving millions of people facing survival challenges. But did you know that cancer is not a disease that just accidentally appears? This disease can silently attack from daily habits, seemingly harmless factors that you do not notice. More specifically, cancer is not just mutation in cells, but it is a long, painful journey of the body with unpredictable changes. So where does cancer come from? What symptoms will your body give you to warn you? Can we prevent and treat this disease effectively? In this article, we will analyze every aspect of cancer, from causes, symptoms, to prevention and treatment solutions. The article is not only for those who are fighting this disease, but also useful for those who want to equip themselves with knowledge to prevent cancer and protect their own health. Cancer is not a random disease, but a complex combination of many factors, from genetics to the environment, from lifestyle habits to harmful agents that you come into contact with every day. In some cases, cancer may be due to genetic factors. A person may have a family history of breast cancer, colon cancer, or other forms of cancer, which increases their risk. Genetic mutations are what cause cancer cells to grow. These cells begin to divide out of control, leading to the formation of tumors. However, not everyone with a gene mutation will definitely get cancer. This depends on other factors in the living environment and habits. Your environment is also an important factor. Air pollution, cigarette smoke, and toxic chemicals in your work or home environment can all damage cells, increase the likelihood of gene mutations, and lead to cancer. In fact, air pollution is a major contributor to lung cancer and many other cancers. Not only that, chemicals such as asbestos, industrial chemicals, or strong detergents also contribute to causing cancer, especially lung cancer and bladder cancer. Another important factor is each person's living habits. Smoking and drinking alcohol are both major risk factors in the development of cancer. Smoking not only causes lung cancer, but also cancers of the throat, mouth, and esophagus. Alcohol, even in low doses, can increase the risk of liver cancer, breast cancer, esophageal cancer. An unscientific diet, low in vegetables and fruits, high in red meat and processed foods also increases the risk of cancer. Colon cancer and stomach cancer. Cancer often has no obvious symptoms in the early stages, making it difficult for patients to detect it in time. However, if you pay attention, you can still recognize some early warning signs. Rapid weight loss without changing your diet or lifestyle can be a sign of cancer. As cancer cells grow, the body becomes worn down and loses energy, leading to unexplained weight loss. Fatigue is a common symptom in many illnesses. But if this feeling of fatigue persists and does not go away even after you have had enough rest, it could be a sign of cancer. This fatigue is the result of the body's struggle to fight the growth of cancer cells. Persistent pain, especially in areas such as the head, abdomen, bones, or chest, can be a sign of cancer. Pain is the body's natural response when cancer cells attack surrounding tissues, causing damage and inflammation. Digestive problems such as constipation, diarrhea, or changes in bowel habits can be signs of colon cancer. At the same time, blood in the stool or urine is also a serious symptom that cannot be ignored. The best way to deal with cancer is to prevent it before it develops. Here are some effective prevention solutions. A balanced diet rich in fruits, vegetables, and whole grains, combined with limited consumption of red meat and processed foods, will help reduce the risk of cancer. At the same time, regular exercise helps keep the body healthy. IMPROV is immune function and reduces the risk of obesity, a major risk factor for many types of cancer. Tobacco and alcohol are two indispensable factors when it comes to the cause of cancer. Quitting smoking and limiting alcohol consumption are simple but effective ways to reduce your risk of cancer. Regular health checkups help you detect cancer early and treat it promptly. Cancer treatment is a complex process involving many different methods, each with its own advantages and limitations. Treatment options depend on the type of cancer, the stage of the disease, the patient's general health, and response to treatment. Although the cure rate of each treatment method is different, an indispensable factor in improving the patient's recovery ability is optimism. This is the factor that helps patients maintain mental health and increase the effectiveness of treatment. Surgery is the mainstay of treatment for many types of cancer, especially when the disease is detected at an early stage. The goal of surgery is to remove the cancerous tumor or infected tissue to stop the growth of cancer cells. Surgery may be performed alone or in combination with other treatments such as chemotherapy or radiotherapy. When cancer is detected early, surgery can have a very high cure rate. For example, for early-stage breast cancer, surgery can give patients a 90 to 95% chance of survival. However, for metastatic or late-stage cancers, surgery can only help control the disease but cannot completely cure it. Chemotherapy uses powerful drugs to kill or stop cancer cells from dividing. This method may be used alone or in combination with surgery and radiation therapy. Chemotherapy is commonly used for cancers such as breast cancer, ovarian cancer, colon cancer, lung cancer, and many others. Although chemotherapy cannot always cure the disease, it can help control the disease, reduce the size of the tumor, and prolong the patient's life. However, chemotherapy also brings many side effects such as hair loss, nausea, fatigue, and weakened immune system, causing patients to face many challenges both physically and mentally. Radiation therapy uses high-energy X-rays or other radiation to kill cancer cells. Radiation therapy can be used alone or in combination with surgery and chemotherapy. It is commonly used for cancers such as head and neck cancer, breast cancer, brain cancer, and bladder cancer. Radiation therapy can achieve a high cure rate if the cancer is detected early and the tumor is not too large. However, for cancers that have spread, radiation therapy mainly helps to relieve pain and control the growth of the tumor rather than completely cure it. Immunotherapy is a new treatment in cancer treatment, which aims to enhance the body's immune system to fight cancer cells. This therapy has shown promising results in the treatment of several types of cancer, especially lung cancer, skin cancer, melanoma, bladder cancer, and kidney cancer. However, immunotherapy does not always work for all patients, and its side effects can be severe, including inflammation, fatigue, and autoimmune disorders. Not only medical methods, optimism and a positive attitude during cancer treatment also play an important role. Many studies have shown that patients with an optimistic spirit and hope for life will have a stronger immune system and be better able to fight disease. A positive mindset also helps reduce stress, relieve pain, and aid in recovery after treatment. In conclusion, cancer treatment is not only a physical process, but also a challenging journey for the patient's spirit. Methods such as surgery, chemotherapy, radiation therapy, and immunotherapy all play an important role in curing cancer, but the success rate depends on many factors. Optimism and a positive attitude not only help patients overcome pain, but also enhance their ability to recover and improve their quality of life.